We won't go without a fight.
I'm a registered nurse and I work in a hospital in John FASO'S district.
Thank you.
And I work with people every day who are incredibly sick because you don't get into the hospital anymore unless you're really sick. We're starting to talk about barriers to care, about how we, not only the stuff that you think of when you think of healthcare, of medication, access to doctors, access to hospitals, but transportation. If they cut back Medicaid and Medicare, you're going to have people who can't get to their preventive care appointments because they can't get from their house to the doctor's office. You're going to talk about people who can't leave their homes, who are no longer going to be able to have nurses who can come to the house and make sure that they're taking their medications as prescribed. There are so many issues that are at risk here, and it's not just as straightforward as getting people to a doctor's office. It's not just about people on Medicaid and Medicare. This is going to affect all of us. We all pay for these systems. So if you cut access to people, it just means the people who have access are going to pay more.
You know, it's a shame today that John Faso and the Republicans aren't really thinking about how many people are going to be impacted. In fact, last night, they spent into the wee hours of the morning rewriting this health care plan, or lack of health care plan, because there were some Republicans who thought that there were too many benefits in it. And so they've been trying to make it even worse. And John Faso is hiding behind this idea, or going on this party line. And he doesn't really care how many stories have come into his office, how many phone calls there have been into his office. Today, all the lines are busy, the voicemail is full, you cannot get a fax through, and that says that we are fighting. And we need to keep fighting. We have to remember, no matter what happens today, we need to keep fighting, because if we retreat back into our shells, if we get angry and we don't want to fight, they are going to continue to try to gut everything that we have been working so hard for.
I got a gorgeous little granddaughter who's wonderful, buoyant, and beautiful. Only thing is, every time she gets the flu, she needs a blood transfusion, and needs it because of a disorder that she was born with. Talk about a pre-existing condition. Without ACA, I hate to think what's going to happen to her, and with hundreds of thousands like her, and all because Faso doesn't give a damn. He doesn't give a damn because his insurance is great, thank you very much. Yeah. I've got mine, he thinks, so you're on for yourselves. Take care of it whatever you can, because I don't care. All I care about is the money.
Hands off Medicare! Hands off Medicaid! Hands off healthcare! Hands off Obamacare! Hands off Medicare! Hands off Medicaid! Hands off healthcare!
Dr. Feelgood!
I'm actually here today with NYSNA, the New York State Nurses Association, and behind me are the heroes that take care of patients every single day. And they know firsthand, right, what this FASO and Collins Amendment bill will do. It will devastate the delivery of health care in New York State.
That ain't right.
That ain't right.
That ain't right.
Do you realize that this state is looking to lose $7.2 billion of Medicaid funding because of people like John Faso? The nurses behind me have a message to Mr. Congressman, and that is take the same oath that they took, and that is to deliver care, quality, good care to everyone, not the elite. FASO, FASO, can't you see? This is a healthcare emergency.
FASO, FASO, can't you see?
This is a healthcare
emergency. FASO, FASO, can't you see? This is a healthcare emergency. FASO, FASO, can't you see? This is a healthcare emergency.
My name is Lawrence Clayton. I'm a union nurse. I'm a union nurse because of the ACA. When I changed careers, when I quit my construction job, I got health care through the New York State Exchange. Without the exchange, I could never have afforded health care, and I could have never changed careers and done what I love, which is caring for patients. The vast majority of my patients are on Medicaid.
Yes!
What's going to happen to Medicaid if this passes? They're going to die. They're not going to get the care they need. John Faso, if you pass this bill, if you vote for this bill, you own this bill.
What do we want? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now! What do we need?
If we don't get it,
Shut it down!
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 you can leave a comment and you can make
What do we want? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now! When do we want it? Now! When do we want it? Now! We don't get it. Shut it down! If we don't get it. Shut it down! If we don't get it. Shut it down! If we don't get it. Shut it down!
Just imagine, in a very negative way, what a $7.2 billion cut to New York State over the next 4 years is going to mean if you have a loved one in a nursing home or a hospital. It's going to mean there's less people to take care of them because there will be layoffs as a result of this greedy guys and his patrons who fund him their interest for their $900 billion tax cut for the very wealthiest. That's the payday for those folks.
The people united will never be defeated. The people united will never be defeated.